But first up, for the first time in human history, our generation has the financial and technical capacity to eliminate health disparities between poorer as well as healthier, or rather wealthier nations. This is according to a new report, Global Health 2035, a world converging within a generation. The authors urge world leaders to incorporate this grand convergence into their post-Millennium development goals framework. Joining us in studio to share his enthusiasm at this launch is Professor Mthuli Ncube, who is the Vice President as well as Chief Economist at the African Development Bank. Prof, your enthusiasm regarding this, no doubt it can have global and world-changing and groundbreaking outcomes. What are your expectations should such an initiative be taken up by various countries?
We expect certainly the world to achieve this great convergence in the next 20 years, and we're very enthusiastic, and we firmly believe this is doable. Because think about what other countries have achieved already. Look at Cuba, look at China, look at Chile, look at Costa Rica, as we call them, the 4 Cs. And we believe that low-income countries can achieve what these countries have achieved certainly in the next 20 years. It's possible, all through financing, controlling their domestic finances better, or through technological advancement, through better delivery systems, through targeting certain diseases, your TBs, HIV, even some tropical diseases. Is doable.
You mentioned that it is doable, and one of the main areas that you touched on is financing. From the African Development Bank's perspective, how do we roll that out efficiently in order to rule out corruption and potential theft?
Well, you know, there are so many financiers around the world, not just us, you know, governments themselves and so forth. And the issue of the report really is to say to the government, please take control of the financing of your own health. You can do it. That's what you have to do for the citizenry. And we're highlighting that countries are discovering natural resources, certainly here in Africa, and managing those resources more efficiently can deliver the sort of services that are required in the healthcare sector. But also we're saying that this is a partnership. It's the African Development Bank, is the World Bank, is everyone involved. It's basically the philanthropy and other donors who have to come to the party. But the central issue is that countries have to take control of this agenda.
You also touched on innovation as well as technological developments which are currently thriving in the world market, but it seems as though it all takes place in different silos. How do we cut down on those barriers to ensure that there's easy access towards the technological advancements? Well,
of course, the technology, the issue there is access, is affordability, and so forth. But I think that we're beginning to see technologies being massified. There's an opportunity to massify. The other day I was taking a look, for instance, at an iPad app and an iPhone app developed in Kenya for delivering health services, where you can track whether patients are, you know, consuming, you know, fake drugs or not, whether they're doing the right thing in following their prescriptions, and it has the capacity to inform the doctor as well. So very, you know, incredible technologies that are being developed, and this can be massified easily. So we're getting better every time, but we need to increase our research and development in R&D from the current 3 billion to 6 billion. We have to double that in the next 20 years if we're to achieve this great convergence.
And research and development from an African perspective, you touched on natural resources coming to the fore as potential remedies for several ailments. Are we seeing more of that on the African sphere?
No, and I don't think it should be Africa really. Where we can do it, let's do it. The African countries are not wealthy, neither are they technologically advanced, but where I see great opportunities in delivery systems, Africa is beginning to come up with ways for service delivery, which in my view are leapfrogging the world and are actually showing in an awkward sort of way the benefit of backwardness. It gives you the ability to leapfrog through technology. We're seeing that in Kenya already. You're beginning to see it in Ghana in ways that is improving even the global supply chain and tracking of information for drug manufacturing companies.
From a South African perspective, we know that we've got the talks regarding the National Health Insurance Fund. It's been slightly quiet. No major news coming out from that front, but is it a game changer in our industry?
Certainly. One of the messages in the report here is our progressive move towards universal coverage. We are advocating that. And South Africa, in our view, through this universal coverage agenda, is going the right track. So in principle, we support the NHI initiative. Of course, there can be debates as to how it is designed, who is paying, has it got any tax element or budgetary issues around it. But really the principle is the right one. We need universal coverage. But also, we also need the taxation of alcohol, of cigarettes and so forth, so that we can impact on non-communicable diseases as well. because, as you know, this is an issue of the middle class. As people get wealthier, there's more hypertension. These are the diseases of the wealthy, which is got to do with poor diet. So by taxing that and reduces subsidies where there are subsidies, we'll move a long way towards the great convergence.
And incentivizing South African citizens to take more responsibility over their healthcare services. Are we doing enough of that, or does government and the private sector really need to sit down at the table and find a good way forward?
Frankly, we need to do more. It's very difficult to change human behavior. You know, it's not easy. It's never easy. So we just have to keep at it, keep going at it. I think we'll see the impact. For example, we've seen that just by increasing the taxes on cigarettes in China by 50%. China can raise an additional $20 billion a year and you know, reduce deaths by as much as 20 million. So that's a big figure. Surely there's such similar benefits can be calculated for South Africa. They are there, and we should carry on with this kind of initiative. So there are lessons to be learned from the global community. Absolutely. Any that come top of mind from countries like Cuba that you listed earlier on, as well as China, perhaps? Well, it's just really trying to highlight the benefits of targeting. You target a specific disease, whether it is HIV prevention, whether it's tuberculosis, malaria, and so forth. Targeting these diseases has a lot of benefits. Number two, taking control of the agenda yourselves as a country is very critical. Then you can focus. Thinking about how to finance the healthcare agenda, but also, you know what? There are real economic benefits to investing in health. We're finding that as much as 1.8% of economic growth in poorer countries has to do with investing in health. Investing in health is giving us 9 times at least economic benefits compared to the cost of doing it. It's incredible. How does that work out? You have a healthier population, they turn out to be more productive, thus we have great economic growth. You get it. And beyond, there's also value in itself, the intrinsic value of being healthy, of living longer. How do you place value on longer life? Well, we're economists, so what we do is we say, how much income are you willing to give up now for one extra life longer? We call it a substitution effect. That's how we get to figures of this 1.8% which I spoke about. That's how economists we think about it. But quite clearly, there is intrinsic value in healthier lives beyond productivity. And as you say, you can't necessarily put a value on one's life. But looking back at the 3 illnesses that you targeted earlier, HIV, tuberculosis, as well as malaria, both very rife on the African continent, have we made progress if you look back on the last 5, perhaps 10 years? Definitely made progress. You look at countries like Rwanda, for instance, incredible progress on child mortality, on maternal health, malaria incidence, tuberculosis, all the way. It just shows you the value of focus, taking just a charge of the agenda domestically by government to make sure this sort of thing happens. We improve the quality of lives. So it is doable, but there are a lot of challenges on service delivery. I can tell you, doctors spending 30 minutes with their patients on a daily basis, and half the time you don't know where they are. Either moonlighting or focusing on their private businesses is happening a lot. How do you incentivize them? How do you monitor them? It's not easy. Institutional design for service delivery is never easy anywhere in the world. Everyone struggles with it. That's the challenge going forward as well. Are we at least identifying how to tackle it? Absolutely. First of all, recognizing the problem. I look at South Africa here, the government has already said, and they recognize that we need to improve service delivery. I was reading this morning, yesterday, this it's called the district hospitals barometer for South Africa, which shows you which hospitals, which service centers, health service centers are doing better at service delivery than others, and we rank them every year. To me, that's really the beginnings of monitoring, because monitoring is a critical part of service delivery. Certainly, it's going in the right direction, and we should fix it, but also use technology to deliver these services. Professor Ntuli Ncube, it's such a pleasure speaking to you. Thank you so much for your enthusiasm that you shared with us today. Prof is with the African Development Bank.